Greetings, everyone. Welcome. Today is Friday, June 5th. It's good that it's Friday. I hope everybody takes time this weekend to enjoy themselves a little bit. Again, we have the Friday mental health check, so thank you again for some time to think about that. It's been a tough week for many. Our neighbors, our friends, our community are hurting. Not only is COVID-19 difficult, but certainly all of the challenging conversations and critical conversations about race are also mentally and physically challenging. This is important work that we're doing, paying attention to communicable disease and paying attention to racial inequities in our community, but it's tough. So paying attention to your own mental health and those around you is critically important. For those that are directly impacted by racial equity issues, this isn't okay. We all need to pay attention to it. And in COVID-19, we know that this disease, like many, is disproportionately impacting people of color, and we need to change that. The plan for rallies and marches in Eau Claire this week and moving forward gives some voice to the need for those changes. But during COVID-19, my ask of all of you is to give that voice and share your thoughts at those rallies, but make sure that that you remember that this disease has not taken a break, that it is still important to keep physical distance, to stay home if you're sick, and to wear a cloth face covering in those situations where you're out, giving voice to the important issues that are being discussed in our community. So today we'll do some updates like we usually do. We'll share a little bit about mental health as I discussed, and then I'll be back for questions after that. Our state update. We now have 303,332 negative tests for COVID-19, an increase of close to 12,000 since yesterday. Positive cases of COVID-19 in Wisconsin are at 20,249, an increase of 357 since yesterday. 2,791 people in Wisconsin have been hospitalized for COVID-19, and we are now at 633 deaths, an increase of 7 people have died, Wisconsin residents have died of COVID-19. The Eau Claire update. Again, this is the data that is reported consistently on our website as well as the state website. It's updated at 2 o'clock every day. Our numbers are not current through right now at 2 o'clock. They are pulled yesterday, and so our updates are always lagging a bit behind. But currently we are at, according to those numbers, 5,560 negative tests, an increase of 226 in Eau Claire, 119 positive COVID-19 cases, an increase of 3 since yesterday, and now we're at 94 recovered. This is the data that we share with you that the state documents related to those with resolved symptoms of COVID-19. We have lots of additional metrics on our COVID-19 website. That website is covid19eauclaire.org. Not only do we share the numbers of positives and negative cases, but we also share information about the age and gender breakdown of cases. And we have the metrics that we are tracking over time to really look at what is happening with the disease in our community, with healthcare capacity and with public health capacity. We are trying to make decisions based on data and what we know about the disease at this point in time. And as you know, those data points regularly change, and we are watching those and making sure that we are staying on top of knowing what's going on in the community. Sometimes we get the question that we don't have a lot of active cases. We've had 119 total, but not as many are currently active. Why are we so worried? I'd like to remind everybody that COVID-19 is a disease different than many of our serious communicable diseases where people have it and they may not know they have it. So there are likely many, many more people that are not symptomatic, are not being tested, that are positive and are spreading the disease to those that may be at risk. Again, those people at risk are those that are elderly, those that are immune compromised, and people that are in situations where, for whatever reason, they are not as able to fight the disease. We know that as we keep our circles small and we follow best practices in public health, we will keep the spread as slow as possible, and that continues to be our goal. We know from other communities and other countries where there are big outbreaks and where spread is happening rapidly. We don't want that. We don't want the spread of disease and death to happen in a way here that is really not in control. So our goal continues to be to keep that number of active cases as low as possible to not overwhelm our systems. A couple of national updates for you. Today, in the CDC in their regular communication did report that as many as 1 in 3 people across the U.S. are using chemicals or disinfectants unsafely while they're trying to protect themselves from COVID-19. An important message to everybody is that, yes, we want people to clean. We want them to do it safely, and the dangers are there if you are using cleaning products in a way that is not safe. The survey that CDC announced today is that the chemicals that some people are using in cleaning can be dangerous, and the people are reporting that they are using them, 1 out of 3 people, in dangerous ways. So we don't want there to be problems because you're trying to protect yourself from COVID-19. Remember to wash fruits and vegetables with water, not with bleach or other household cleaners. To wash your hands often with soap and water, but cleaning chemicals are not for use on your hands. Wear gloves when you're using those cleaning chemicals. Again, it's especially dangerous with some chemicals and the fumes if they are combined in ways that are not supposed to be combined. So don't drink household chemicals and don't combine them in ways that are not recommended. Going to our COVID website is another place you can go for more information on this topic. Again, under the Individuals and Families tab, there is more information on being safe with cleaning products. It's at covid19eauclaire.org, again under the Individual and Family tab. The state has recently announced dollars available for reimbursement for some of the providers in our community that are providing home and community-based services. So those in Eau Claire County that are in the worlds of home health, personal care, assisted living, community-based services, and EMS, among many others, are eligible for funding related to the impact of COVID-19. So if those folks in Eau Claire County are not aware of that, please make sure that you look for those resources and information. Certainly calling our hotline for more information about that is also a possibility. You may have noticed that some of the local testing sites are no longer doing drive-in testing. Just a reminder that we do have very available testing in Eau Claire County. Some of the drive-up sites, it was determined that was not the best methodology to get people tested quickly. So other methodologies are being used by healthcare, but do know that there is plenty of testing available to residents in this community to get tested if you are symptomatic. And we are asking everybody that has even mild symptoms that are COVID-19 related to be tested. Contact your healthcare provider. If you have any trouble with being tested when you are symptomatic, please contact the COVID hotline. That number is at 715-831-7425. A little bit about the public health order that is in place in Eau Claire. Many know that it does have a date at the end date of June 11th, which is next week. As we've talked about before, we are watching the data to make sure that we are making decisions to move forward carefully and deliberately based on the data that we have. We posted the most recent data that's in that dashboard that's got yellow, green, and red on it. That was posted on Wednesday and will be posted on Wednesday every week. It'll be a week's worth of data that gets pulled starting ending on Monday night. So we review it on Tuesday and post it on Wednesday. So people can look at that on Wednesday and see where our current dashboard is at. We are going to be, again, looking at that carefully. We've looked at this week's data. We will be looking at that next week, Tuesday, and making decisions about what happens next with the order. We know, and if you look at the site, that there are a number of red and yellow boxes remaining in the criteria that we are looking at. That doesn't mean that we are going backwards in the order or that we necessarily are staying flat, but we are watching that, and there likely will be some small changes to the order. Knowing that we are not at capacity for hospital care and we are reaching most of the capacity indicators for public health. Some of the things that are making us worried related to the data is that we do have a significant increase in our percent cases from the last 14-week period to this week 14-week period. We also have a high percentage of people in our caseload that don't know where they got the disease. So those are community spread cases at 47%, which is significantly higher than what we've seen as we've gone through this disease and significantly higher than what many in other parts of the state are seeing as well. So you will hear more from us next week about what it will be happening with that order. Again, that reminder that you can look at the data that we are looking at on Wednesdays. We will be evaluating that and every 2 weeks at least making sure that we are looking at possible adjustments to the order. You may remember that 2 weeks is kind of that incubation of the disease, and that's why that 2-week framework is minimally important. Certainly, that's the shortest amount of time that we would know whether or not a change has made a difference because of the change in policy. Our goal, if the data supports it, is to continue to open the community up, to continue to have people do those things that they really are wanting to do. Goals like having larger group gatherings with physical distance and other safety measures still in place continue to be where we are headed. So now I will have Luke Feedy, who is here, the Behavioral Health Administrator for our county, come and share with you some updates on mental health, and then I'll be back to answer questions.
Thank you, Liska. I first want to just point out the importance of continuing these critical conversations around systemic racism and oppression, and the importance of listening to and working to understand the experiences of people of color in and outside of our community. So I want to echo what Liska started with. So we want to take a brief moment to talk about social media today. For most of us, social media is an integral part of our lives. It can help us stay connected with family and friends and can act as a platform to share ideas, to share thoughts. When social media is a tool, when we use it as a tool to bring people together and stay connected, it can be harmless and it can be safe. Unfortunately, there are some that use social media for more nefarious purposes. In some cases, social media has been used to further the divides between people. When exposed to this on a continual basis, when we continue to have this information come to us, this has a significant impact on our mental health. It can leave us feeling anxious, it can leave us feeling angry, even depressed. It is important for all of us to take time to reflect on how we feel when we're using social media. If you are finding that you feel anxious, depressed, angry, frustrated when using social media, you may want to work to limit your use. Avoiding social media altogether can be an almost impossible task. We're inundated with messages every day, and it'd be difficult to ignore all of those messages that come in. Limiting social media, however, can be done through some easy steps. So I'm going to give 3 easy steps today that can really help limit exposure to social media. One is taking a time to just turn the notifications off on our phones. It's so easy to be distracted. We have things popping up, dinging and chiming all the time, and we want to respond quickly. By turning those notifications off, we can work to be more present in our everyday lives and be with the people we want to be with. The second is setting some time frames when using social media. I know I'm not the only one who's ever been humbled when my phone gives me my screen report at the end of the week. Often I spend far more time than I should within social media. So taking the time to realize how much time we are spending and then asking ourselves what we can do and what's an appropriate time frame can be really important. And then work to adhere to that time frame. The third is try something new. Sometimes we say that we don't have anything else to do than to scroll through our phones or read feeds that are coming in. And I'm going to encourage everyone to try something new. Perhaps you bought a guitar 3 years ago and haven't picked it up since. Maybe it's time to give that a shot. The final word that I want to say on social media really goes back to a message that I received when I was younger. My parents said it to me growing up, and I'm sure that some of your parents said it to you as well. If you don't have anything nice to say, don't say anything at all. We have an opportunity to educate one another through social media. We have an opportunity to learn from one another on social media, to share thoughts and ideas. I am encouraging all of us to use social media in constructive ways that allow us to grow together as a community. The most important thing that we can do right now is celebrate our humanity by being kind and compassionate with one another. Thank you for your time.
Thank you, Luke. It's a simple message, but an important one, to be kind. And I think we all need to remember that. So thanks for sharing that. Of course, my notes next say to stay tuned to our website and our social media for more information on COVID-19. And I would reiterate that, as Luke said, to do things in ways that are not overwhelming you. It's critically important. For good information, go to good sites. Don't spend time on places that aren't going to give you the information you need. But if you need some up-to-date information on COVID-19, a reminder, COVID-19, eauclaire.org, and the call center if you really need to talk through with someone what to do next if you don't have the information you need. That phone number is 715-831-7425. Again, thanks for everybody's efforts. It does make a difference. The slower we have the spread of this disease, the better in this community, and it's working so far to have slow spread. The sunny weekend ahead is another opportunity to be out and about. My ask of all of you is that if you're not feeling well, that you stay home and don't risk others getting ill from what you have. When you're out and about, to keep your circle small, to use a cloth face covering, and to keep physical distance. I think there may be some funny tan lines that we could start promoting if we're all wearing cloth face coverings out in the sun. So maybe think about that as a challenge to your friends and colleagues. Again, thank you for joining us. We'll be back on Monday. Do stay tuned to what our schedule will be moving forward, but we'll be back on Monday with our usual updates. Any questions today? Yes?
On your website, you talked a little bit about thrift sales, garage sales, items like that. If you could just real quick comment on if people are interested in doing them, kind of gone over this over and over again, but just as a quick reminder for people, regarding thrift sales, garage sales, stuff like that.
Yeah, so the question is related to thrift sales and garage sales and best practices around those types of events. Again, this is the season for doing events like thrift sales and garage sales. The encouragement continues to be to use all those basic common sense guidelines that we have to make sure that there is ability for people to be separate from each other, to wear a cloth face covering if you are the person that is having the garage sale, and encourage others to wear them as well. To make sure that things are cleaned carefully. If you're able to have ways of collecting the money from the thrift sale in ways that are other than cash being handed back and forth, so that there's a lot of hand contact, those are recommendations. And really look at our website for additional information. Our overall goal is distance is our primary way to prevent COVID-19, and that continues in whatever setting exists. So giving people opportunity to not have close distances because they have to be packed in to do your thrift sale. And then also to pay attention to things like really making sure that you're cleaning in between people and around people, and not having things like grab bins where you have to touch everything in that. So again, think about payment methods, think about distance, and think about ways to make sure that cleaning is part of what you're doing with that sale. Those are also, events where we often have socialization. We talk to our neighbors because they happen to be having a garage sale near us. Physical distance, again, critically important. Yes?
With the warm weather coming up, I'm wondering if you can speak to how safe it is to go swimming, say at a local beach. People still wear masks. Is there more danger in standing water versus a river? Can you speak to that?
So some questions about swimming. People do enjoy water this time of year, and with COVID-19, there's not evidence that water specifically is a concern. The concern continues to be making sure that you have physical distance. So if you can be in a water body safely and paying attention to all the water safety measures that are critically important, and have physical distance and be with your small group, again, those kinds of activities are encouraged. Going to a place where there are lots of people close by in contact and physical distance can't be maintained, that's a concern. So we want you to really think that through and be safe. Distance is the most important thing that you can do in any of these settings. With going to our places where there is water, making sure you're also washing your hands, not eating food while you are there if you're not, making sure your hands are clean, and making sure that you are not going if you are not feeling well. Staying home when you are sick is critically important. Mask uses at whether you're at the beach or at the river, kayaking or canoeing. If you're with a group of people, we would recommend people use a mask, but certainly not while you're in the water. I think hopefully that's fairly common sense to most everybody, but a cloth face covering getting wet is not protective. So in the water, not using a cloth face covering, but using distance for all purposes. We do know that in Eau Claire, we have had a number of fire rescue events already with water in Eau Claire on the rivers. So please pay attention to safety measures well beyond those related to COVID-19. People that are in boats or in kayaks or on rafts that are in the river, it is a dangerous situation if people are not careful. So my strong encouragement, not related to COVID-19, but certainly a real health issue, is to pay attention to the water that you are going into, both where you enter the water and what you will be facing as you go downriver. We are having issues in this community, and people need to be safe. Yeah.
You referenced earlier the rallies, the protests. There's another one tonight that could have a lot of people. I was at one last night. Are you worried about a surge locally? And they're not just here, they're all around the state and the nation. Are there worries amongst public health officials? Or to what degree are you guys worried about there being a surge of sorts because of this?
because of rallies. Yeah, so the question is related to what's the public health concern with the rallies that we are seeing, the protests and the marches that are happening, not only in our community, but across the U.S. There is a public health concern. People close together for extended periods of time create a risk that is real for COVID-19. We know that that is one of the ways that the disease is spread. There are ways to lower that risk, and we're strongly encouraging people to do those things. So going to rallies and having your voice heard is something that is important in our communities. Doing that separately in ways that are separated in a distance way with a cloth face covering on will help decrease the risk. And also, talking to the people that you are going to those things with to make sure that they understand, too, the importance of cloth face coverings. And if they're not feeling well, how it's much better for them to stay home rather than go to the rally to support in other ways. I shared with a colleague just a few minutes ago that I got a text from my son, who is in the Twin Cities and very actively involved in the rallies that are happening there. And he found out today that he is a contact to a case. So he is staying home now and very upset about it from the rallies there. But we all have to do our part in different ways. So I think every one of us can do that. And yesterday, I walked over to Owen Park after a meeting. I got there late, but people were very respectfully sitting at a distance apart and participating. And that I really appreciate that this is a community that cares not only about having a voice with this strong communication about racism, but also gets that COVID-19 is a risk. So my kudos to people that were there last night, and I hope that we continue to see that in Eau Claire. Yeah.
Going into that a little more, when they do the contact tracing, especially with all these rallies going on, when it came to the election, there was, I guess, a check mark of did you vote, did you not vote. Is this one of the things that they're checking now? Did you attend one of these rallies? Did you attend a large rally? And maybe how much does that even complicate contact tracing when you're talking about thousands of people all within a group?
Yeah. So the question is about contact tracing in situations like this where there are many, many people that potentially are exposed if a case is identified that had been at one of these rallies or in an event where there are many people. Clearly, part of the reason we're trying to keep groups small is to decrease the spread in a group size like that. That's part of why our order reads the way it does, because that is a place where disease can spread. The goal with contact tracing is to identify people that were in a nearby distance within that 6 feet for 15 minutes or more. And that could be a fair number of people that are around you if you are at a rally and not keeping physical distance. It will complicate our ability to follow up with people that are contacts and have them stay home. It may contribute to additional spread of the disease. So again, what we do at these rallies and in these situations where we're with others makes a difference. Again, we've talked before about in this room, we are at a distance, we are making sure that we are not coming in close contact. So that means that if I'm a case, none of you are contacts, and that's a good thing because you'll be able to continue to do your job and live your life in a way that is not impacted by my disease. We want the same thing in these rally situations or any other situation where the contacts hopefully are small as possible, not hundreds of people potentially. Yeah.
With playgrounds opening up today, obviously as adults we're pretty good at keeping the social distancing, but with younger kids it can be more difficult getting them to maybe stay away from friends and any other kids that are on the playground. I guess any words of advice for people when they're going out to playgrounds? Obviously there's a lot of kids touching the equipment and all that stuff, but I guess just your general comment on that with the playgrounds now.
Sure. So the question is around playgrounds reopening in Eau Claire County, and what are the recommendations related to that to decrease the potential spread of COVID-19 in those situations. Playgrounds are certainly a place where kids like to be together and are touching lots of surfaces. It's why they've been closed up until now, and they remain a risk. And I think parents need to understand that if they choose to take their children to playgrounds, that there is a risk of transmission of disease. The cleaning that happens there and the monitoring that happens there are not sufficient to eliminate that risk. Some of the things that parents can do when they go is to try and go when the number of people there is as low as possible. If there's lots of kids there, I would recommend that you walk over to a different part of the park and play a different game for a while before you go climb on the playground equipment. To make sure that you are there with as few a number of people and for as short a time as you can. I know, again, people like to go there with their children and it's a fun activity. Washing hands before and after is critically important. Making sure that food is not eaten as part of that environment is critically important. All those potentially bring virus to the mouth or nose where the spread can happen. And then really making sure you're staying home if you are sick. So if your children are sick, if you are sick, and the likelihood is that they may also have that illness, to stay home and make sure that that disease is not spread. Again, there is a risk, and our ask is for people to really think about managing that. If you're in a family where you may expose people that are at significant risk of getting very ill of this disease, to think twice about going to that environment and finding another way to take your kids out, be outside and enjoy the outside weather, but not in an environment where that kind of exposure might happen. All right. Thank you very much, everyone, for participating today and for listening in. Thanks for doing your part to slow down the spread of this disease, and we will be back on Monday to talk more with you. Thanks.